marks World Arthritis Day. Arthritis is a leading cause of disability in the U.S., and nearly 60 million Americans have been diagnosed. But there are more than 100 forms of arthritis, and like many chronic illnesses, the disease can be very difficult to navigate, which makes self-advocacy extremely important for patients. Dr. Amanda Nelson is joining us now to help bring awareness to arthritis and other related diseases. She's an associate professor of medicine at UNC and co-chair of an Arthritis Foundation expert panel. Thanks for joining us this morning. How can arthritis patients, and really anyone, advocate for themselves when they're at the doctor's office?
Yeah, I think it's really important that people share their experience with their doctor. And like you said, even with their family members, to say, this is what I'm going through in my daily life. This is how it impacts, my activities of daily living, the things I normally would enjoy, my overall quality of life, and just, how I go about my day, so that people can really understand the impact that the symptoms are having.
Mm-hmm. And I know sometimes the advice that you do get from a doctor has to do with just your lifestyle choices. And often it's exercise, sleep. It's this sort of stuff that we hear over and over again. How seriously should people take that? The lifestyle choices, the impact it could have, as opposed to, what a prescription could do?
Absolutely. That's a great question. So this is the best way that people can advocate for themselves, is really to take on these lifestyle changes, these behavioral modifications, and own those and say, this is how I can make this condition better. And really, I provide my patients with a walking prescription. So exercise is part of their prescription therapy for their arthritis, because it is so important to reducing pain and increasing function. And that person can really take that and go with it. And some people do, and obviously other people don't. But exercise is the best thing we have, especially for the most common form of arthritis, which is osteoarthritis, which there is no medication for. So the prescription I can provide is for those behavioral modifications.
I can see how that would be sort of challenging for people to be willing to do, because when they move, they're in pain. But exercise actually helps with the pain?
Yes. So there have been several studies that show that people have less pain over time and report more self-reported physical function, meaning they feel that they can do more things the more active that they are.
Sometimes arthritis patients actually have to, fail on one medication before they're able to try a new one. I'm sure that can be incredibly frustrating when you're telling your doctor, this isn't working. Like, what else do you have? Do you have any advice on working with your doctor and insurance companies in those sort of cases?
Yeah, so this is the step therapy situation. So particularly for rheumatoid arthritis and other inflammatory types of arthritis where there are multiple medication options, many times a patient and a doctor are forced to go through certain order of medication. So you have to fail medication A to move on to medication B, even though perhaps the patient and doctor would prefer to go on to medication B or C first. And that can be very frustrating. And so documenting those things, making sure that your doctor understands the impact that those choices are having on your life, so that they can then, advocate on your behalf with the insurance. I've rarely had the case where the patient can directly advocate for themselves to the insurance company, but just, keeping track of that stuff, making sure that it's clear in the notes, in the patient's experience, that this is really impacting their life.
All right. Dr. Amanda Nelson, thank you very much.
Thank you.